A lot of dentists will call us and ask us, how do I really measure my return on investment for my marketing efforts? How do they do
It was
that?
actually a question on one of the dental forums. I think it was on Dental Town. I think it was this week.
Oh,
So a dentist was asking the same question. Well, you may or may not have viewed the other video that goes through the two halves of the market. If you haven't, you should, because that's a prerequisite to what I'm about to say. If you promote to the bottom half of the market, your first year average return from those patients is going to be, right now it's $415 to $617. There's a mean average there.
revenue per patient?
Revenue, first year revenue per new patient. If you go after the top, the range is $1,100 to $1,400. Okay? So the first thing you need to do is you need to figure out which half do I want to go after. All right? The bottom half will drive more volume initially. The top half will drive less volume, higher revenue. But here's the kicker. Here's where dentists become myopic. Myopia is short-sightedness. It's the recurring revenue. It's the revenue after the first year. If you promote to the top half of the market, the first year return will double every 3 years for 6 years and then double again in 12. Okay? So if you got a 3-to-1 return in your first year, in 3 years it's going to turn to 6-to-1. 6 years it's going to turn to 12-to-1, and 12 more years it's going to be a really robust 24-to-1.
Yep.
Okay? How does that happen? Because if you measure an ROI in a given time frame, the only way that's really the total is if you close your practice tomorrow. Those patients are going to get work later on. They're going to come in for their recare. They're going to refer patients. Those patients are going to get work done. They're going to refer patients, and so on and so on and so on, like a molecular viral spread.
Yeah.
Okay, and that molecular viral spread, if you promote to the top, it's enormously robust. If you promote to the bottom, the first year ROI may double in 12 years. Okay, so if you're thinking to yourself, yeah, I know practices that are constantly seeing 100 new patients a month, and you say to yourself, well, how do they get them? Our question would be, why do they need them?
Yeah.
Okay, our question is, why? Why would you need 100 new patients for a 1 or 2 doctor practice when 23 to 45 would do just fine? And it would grow revenues exponentially. Mm-hmm. The bottom half of the market is much less compliant to recare, much less compliant to referring, and much more.
They don't show up as often either.
They're going to refer. Well, they're not going to get all their work done either. They're not going to value their mouth. They're not going to value your work. Okay, but the people that they refer are going to have the same value point.
Yeah.
Okay, for the most part.
Yeah.
There's going to be odd circumstances where that's not true, but for the most part, the math shows it. Doesn't mean the bottom is wrong and the top is right. Doesn't mean the top is wrong and the bottom is right. It's not about that. It's not about that. They're both viable markets. The real important part of this is you. You're the CEO of your business. You have 2 choices. You can go after the top. You have 3 choices. Go after the top. You can go after the bottom. If you do it properly, you can go after both. You have all those options in front of you. You need to know what to expect from your ROI moving forward. Most dentists, most solo practices, or even partnerships, or even 3 or 4 doctor practices that come to us, what they really want is revenue increase.
Right.
Okay. They
want to do more dentistry on not as many people. They don't want to have to depend on a huge volume to support themselves.
There are exceptions.
Yeah.
Obviously, capacity increases, startups, but for the most part, established practices come to us and say, I actually want to see less people, but I want to grow my business.
Yeah.
Okay. And that's what you expect. That's what you expect as far as ROI from the bottom. And that's what you expect as far as ROI from the top. We already established that the bottom responds more volume initially, and the top responds less volume initially. And that's the rub. Dentists want to go after the top of the market, but they're not really willing, okay? They feel a little weird about letting it build that momentum, okay? And thankfully, there's at least a few hundred dentists in this country that trust us to do that and have gotten through their first year, and they just, they just keep going and going and going.
Yep.